Welcome to Justice with Dr. V. I'm a doctor and a lawyer. I have a national litigation practice and represent those who have suffered catastrophic injuries. Today's episode is about bed sores. What happens if you walk into a hospital room and you see that your mother has a bed sore? What are they and what should you do? What is a bed sore? A bed sore is a decubitus ulcer. A decubitus ulcer is a pressure injury. They're all the same thing. What is the etiology of pressure injuries? It's unrelieved pressure. And that means that a patient who is dependent and can't turn or reposition every 2 hours, they need to be assisted with their pressure reliefs and repositioned, because if you don't relieve the pressure every 2 hours, the muscle between the skin and the bone will lose its blood supply and it will liquefy over time and ultimately have a serious injury. I learned about bed sores early during my third year in medical school at Tulane. I walked into a patient's room that I was expected to work up and understand the injury. And I walked into a room and the odor was something that I never will forget. And unfortunately, as a doctor, I've smelled that odor maybe 100 times. And that's what a bed sore becomes if it's not taken care of. It becomes a necrotic, infected area of dead tissue that is that it goes down to bone, and it's one of the most serious injuries a person could have, and it's one of the saddest, most preventable injuries that occur in hospitals and nursing homes. I've taken care of hundreds of patients with bed sores, and these are called never events. Okay, the government in 2004 made them a never event, and that means that it's not expected to happen. Bed sores, when they occur, it's usually just the tip of an iceberg in terms of a facility, nursing home or hospital that has fundamental problems, because when patients are getting bed sores, that means the care at bedside is inadequate. If the care is inadequate at bedside, that means that patients aren't getting assessed by nurses. They're not getting tended to, and they're not being repositioned. And so the most vulnerable patients are the ones who are getting bed sores. So these injuries are generally deep tissue injuries. The grading scale is stage 1, stage 2, stage 3, and stage 4. The pressure will prevent blood supply to the muscle. The muscle will then die because of the lack of oxygen. And when the muscle dies, over 2 to 4 weeks' time, the skin will then turn black and decay. Who's at risk for a bed sore? The population that I took care of as a rehab doctor. I'm a spinal cord injury doctor. So I learned everything about bed sores, how they're managed, how they're cured with flaps. On a spinal cord unit at the VA in Houston, we had 60 patients who had spinal cord injuries, and many of them had chronic bed sores, and we learned how to fix them during my residency. Who else is at risk? It's any person who, because of illness or injury, cannot reposition themselves alone. Those patients are most at risk. Where are the pressure areas? Where do people get bed sores? It's what is in contact with the bed. So the sores can be on your coccyx, which is the tailbone. It could be on the sacrum, which is right there at the very top of your buttock and include the butt on both sides. It could be pressure sores on the heels, which are some of the most serious bed sores that you can have because they can lead to limb loss. Pressure sores can be on the elbows from laying down. They could be on the shoulder blades, and they can be on the scalp where you have a bed sore that's getting into the skull. These are all serious injuries, and those are sores when you're laying on your back. If you're turned on your side, then you get the bed sores on your hip or on your ankle. Again, there's not much meat between the skin and the bone when you're thinking about the hip and the ankles, and those become stage 4 wounds to the bone that have infected bone or osteomyelitis. Sitting sores are some of the most difficult sores to treat because those sores are in your sit area. So right now I kind of feel it on my 2 bones that's at the very top of my thigh. That's the ischium. And those sores, they tend to just be a small area of skin that starts getting discolored, but then it opens up like a flask all the way to the bone. So at the VA in Houston, I learned how to manage pressure injuries for cure. And these wounds you could put your fist in, and you could put 2 fists in. And there are treatments available that people are not receiving. What do you do when your loved one has a bed sore and you learn about it in a hospital or nursing home? First and foremost, you need to make sure your loved one is safe, okay? And when these occurred in the hospital, or if it occurred in a nursing home and they were my patients, I would need to see those wounds immediately, understand how they happened, what shift they may have happened on, and I would make sure that patient is safe. And the way that is done is to ensure that that patient is getting reliable pressure reliefs. Patients, unfortunately, aren't getting the state-of-the-art care. So when that occurred in my hospital, I was not going to discharge my patient out of the hospital until they were fixed, because we know patients who are discharged with stage 4 wounds with bone infections, that they have about a 19% risk of death at 1 year. They have a 44% risk of being readmitted to the hospital because of complications from that bed sore that the hospital caused. So these patients need to be fixed. Well, hospitals aren't paying for the bed sores because they're transferring a patient to a nursing home where they have a high risk of dying. Okay, so they're getting a mistake that they caused, a serious injury, off their financial books by transferring them to either a skilled unit that certainly can't take care of this person, it's a nursing home, or they would sometimes discharge these patients to a long-term acute care hospital that may or may not have the capabilities of providing flap closure. My law firm's position is that if a hospital causes a stage 4 bed sore, they either need to refer that person to a hospital that they know can take care of it for cure, or they keep that patient and have their plastic surgeons and their doctors fix these wounds. It's not terribly difficult to fix these wounds with a flap. Harvard has said that these wounds should be fixed. It doesn't take a Harvard plastic surgeon. Plastic surgeons all over the country know how to do these flaps. It's basically the same: pressure relief, early surgical debridement, nutritional support, IV antibiotic support, and surgical closure, then rehabilitation. It's really quite simple. So what's the cost of a bed sore? Okay, so the government knows how much they cost. It's been published 16 billion a year. Okay, the cost is kind of a destroyed life. Okay, we have people going into the hospital where they have an aspiration episode during an elective procedure and are on a ventilator, and then gets a stage 4 bed sore, and then get discharged to a skilled nursing facility, then ultimately ends up on hospice. Okay, what are the expense of bed sores for the person who suffers them? If you have a bed sore, you generally need to stay in bed and do side to side turns. You need home health care. You need follow-ups with a doctor. All the while, the risk of readmission is, up around 44% for the patients with the most severe bed sores, and the risk of death is 17 to 19%. So when a hospital is sending a patient to a nursing home with a stage 4 wound, we call that an unsafe discharge. We're suing the hospital for causing that bed sore. We're suing that hospital because they're not offering our patient, it's me, our client, effective care. We are suing the doctors who are discharging these patients or our clients to a lower level of care when they need a hospital level of care to receive these services so that they can be cured. So we prosecute these cases. We represent those who have a stage 3 full thickness wound to the muscle or into muscle and bone. We get the medical records. We identify, was it hospital acquired? Was it acquired in a nursing home? And if it's a stage 3, stage 4 bed sore, that's a case that we represent. And early on, we obtain expert reports, and we file a well-pled complaint where we're basically spelling out the negligence to the defense, the hospitals, the nursing homes. We point out what they did wrong, and that we are going to be prepared in trial, and we're going to pursue their case and describe all that they did wrong along the way. Are there any questions?
Let's say my mother is in the hospital and they try to discharge her. How do I make sure they don't discharge her and take her somewhere else?
The way you handled this is, certainly there are many different ways to handle that question, but you need to be able to convey that you want to be seen by a doctor who can potentially fix this problem with reconstructive surgery, and you want to be under the care of a doctor who can offer that if they believe it's necessary. So how you want to convey that, I would never tell a client what to ask a doctor, but I would try to explain to them that you want to be under the care of a doctor who has the tools and the skills to fix them. And if you get discharged without that plan, then you don't have a plan. And we believe the hospital, for making a safe discharge, needs to ensure that there's a path to reconstructive surgery if necessary.
What if the hospital isn't listening to my concerns?
Yeah, that's a sad state of that doesn't say much for their hospital, that they're not taking care of a person who they injured with a serious injury. It doesn't sound like a hospital you want to be in anyways, if that is the case. But what you need to do is talk to the patient advocate. Every hospital has a patient advocate, so you could discuss your concerns to a person who is who is supposed to understand the consumer and what the consumer needs and what the hospital perspective, and have this all written up and make sure that you appeal your insurance, okay, that whoever's paying this understands that you believe you've been seriously injured and you believe you need to stay in the hospital, certainly call me. 817-809-9023, and we'll be just talking shortly.